I talk a lot about operationalizing empathy, right? I often think about how do we bake it into processes and systems that feel more caring to the people within them. And I do think there's a lot of innovation that happens locally. And sometimes I feel like the cracks still teach us something about where we have ongoing opportunity. For a quick example, I had labs drawn recently, and despite having an appointment, I still had to wait in line, even though I had an appointment. And then, right, they still say my name in an open lobby with lots of patients. And then as I'm sitting there, the woman next to me has a jar of pee next to her own sample of urine sitting next to her on a chair in the lobby. And I have to say, I was infuriated by it. The fundamentals, we cannot fit, everybody's abuzz with digital transformation and AI. I think it's great. It will happen. And yet, to me, this was a fundamental violation of human dignity that has no excuse, absolutely no excuse. Shouldn't be happening today in 2024, 20 years after the IOM report calling for patient-centeredness and 6 different improvements for healthcare. And I'll spare you the other example, but I worry and I'm curious about how others see, right, these big lofty ideas we're talking about and the cracks we still see in the system in terms of how these systems are making people feel. What you might have seen that's really successful and something we could all learn from to take to scale, because it broke my heart.
Adrienne, I moderated a panel last week, and I opened up by just asking that question of how many of you, because the 3 panelists were telling their story of drops in the healthcare system. I asked the audience, how many of you, when I ask you about a patient experience and ask you your patient experience, have a story you could share? Right? There's something immediately comes to mind. And I asked, so how many of those are positive versus having been dropped? And of course, most had a drop. And for many of us, some of those drops may not be life-threatening, but I know, like, my own drop led me to have multiple pulmonary emboli and end up in the hospital. So we are risking the lives of our patients because we're not looking at them as people. They're widgets to some of what you were sharing there, Adrienne.